Diabetes is one of the most common chronic health conditions in the world today, affecting hundreds of millions of people across every age group and country. But despite being so widespread, many people still don't fully understand what diabetes actually is, how it develops, and what can be done to manage it. In this video, we'll break down everything you need to know about diabetes, including its causes, symptoms, and treatment options. So, let's start with the basics. Diabetes is a metabolic disorder where your body has trouble regulating blood sugar, also known as glucose. Glucose is the main source of energy for your body's cells. Normally, a hormone called insulin, which is produced by the pancreas, helps move glucose from the bloodstream into your cells so it can be used as fuel. But in diabetes, this process doesn't work properly. Either the body doesn't make enough insulin, or the insulin it does make isn't effective. The result is that glucose builds up in the blood, leading to high blood sugar levels, also known as hyperglycemia. There are mainly two common types of diabetes, type 1 and type 2. Type 1 diabetes usually begins in childhood or adolescence and is caused by the immune system mistakenly attacking and destroying the insulin-producing cells in the pancreas. This means the body produces little to no insulin, and people with type 1 diabetes need daily insulin injections to survive. Type 2 diabetes, on the other hand, is far more common and usually develops later in life, though it's increasingly being seen in younger people as well. In type 2 diabetes, the body still produces insulin, but the cells become resistant to it, meaning the insulin can't do its job properly. Over time, insulin production may also decrease, making the problem worse. Now, let's talk about the causes and risk factors. For type 1 diabetes, the exact cause isn't fully understood, but genetics and autoimmune reactions play a major role. Type 2 diabetes, however, is influenced by a combination of lifestyle and genetic factors. Being overweight or obese, having a sedentary lifestyle, poor diet, and a family history of diabetes all significantly increase the risk. Age is also a factor, with the risk rising after the age of 40, but as mentioned earlier, more young adults and even teenagers are now being diagnosed due to changing lifestyles and unhealthy eating habits. So, how do you know if you might have diabetes? The symptoms can vary depending on how high your blood sugar levels are, but there are some classic signs to watch out for. These include excessive thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, blurred vision, slow healing wounds, and frequent infections. Some people with type 2 diabetes may not notice any symptoms in the early stages, which is why regular health checkups and blood sugar tests are so important. If diabetes is left untreated, it can lead to serious complications over time. High blood sugar damages blood vessels and nerves throughout the body, increasing the risk of heart disease, stroke, kidney failure, vision loss, and nerve damage. This is why early diagnosis and proper management are absolutely crucial. So, how is diabetes treated? Treatment depends on the type of diabetes. For type 1 diabetes, insulin therapy is essential since the body can't produce insulin on its own. People with type 1 need to carefully monitor their blood sugar and adjust their insulin doses based on meals, physical activity, and other factors. For type 2 diabetes, treatment usually starts with lifestyle changes. This includes adopting a healthy, balanced diet, regular physical activity, losing excess weight, and quitting smoking if applicable. If lifestyle changes aren't enough to control blood sugar, doctors may prescribe oral medications that help the body use insulin more effectively. In some cases, insulin injections may also be necessary. Apart from medication and lifestyle management, regular monitoring is a key part of diabetes care. Checking blood sugar levels at home, attending regular doctor visits, and getting routine tests like HbA1c, cholesterol, and kidney function tests all help track progress and prevent complications. But here's the important thing to remember. With proper care and management, people with diabetes can live long, healthy, and active lives. In fact, many complications can be prevented or delayed if blood sugar, blood pressure, and cholesterol levels are kept under control. Education, awareness, and self-management play a huge role in this. To sum it up, diabetes is a condition where the body struggles to regulate blood sugar due to problems with insulin production or insulin action. The two main types, type 1 and type 2, have different causes but similar long-term risks if not managed properly. Recognizing the symptoms early, making healthy lifestyle choices, and following treatment plans can make all the difference. So if you or someone you know is living with diabetes, remember, it's not the end of the world. With the right steps, it's absolutely possible to lead a full and healthy life. So if this video helped you, like, share, and subscribe to Healix Zen. Take care and see you in my next video.